Christine, and today I will be assessing an older adult who has low activity. His name is Captain Jello. He is a 56-year-old diabetic male, complaining about pain, discomfort, and stiffness in his knee and back. He works in a warehouse where he must lift heavy things and bend over a lot. 4 months ago, he damaged his left patella tendon and a slight tear to the left lateral meniscus caused by a fall while carrying a heavy load. He was assessed 1 month ago by a doctor. No damage to the surrounding muscle, but a notice from his doctor saying that he has arthritis in his knees and back and muscle tightness in his back as well, with reduced range of motion in his knee. He currently sits a lot and doesn't do a lot of movement. The pre-screening for Captain Jello, he is a 6'1", weighing 275 pounds, having a BMI of 27.8 and a heart rate of 70/110 beats per minute. His blood pressure showed that it was 140/90, and his Part Q was given and cleared for exercise with no post-operation, but started physical therapy 2 weeks ago. He will continue to do physical therapy for the next 4 to 5 weeks, according to the insurance. For the first assessment that the patient will be doing, Captain Jello will be doing a Balanced Error Score System test, also known as BEST. The patient will do a parallel stance, which is their feet together, hands on hips, and their eyes closed for 20 seconds. You will be looking for sway or any weakness. The second would be doing a single leg stance, where stand on a non-dominant foot, hands on hips, eyes closed for 20 seconds. And the third one will be the tandem, the dominant foot in front of the non-dominant, hands on hips and eyes closed for 20 seconds. 1 point is given for each following stumble, falling, opening eyes, hands removing from hips, or not remaining in position. This assessment will provide a clear insight into how his steadiness is, aka the ability to sway.
As I'm currently demonstrating in the video, you put your feet together, hands on hips the whole time, and close your eyes for 20 seconds. This part is sped up so you can get the general idea of what to do. Now it's Captain Jello's turn to also demonstrate. As you can see, he is doing perfectly fine, showing the appropriate amount of sway. For this demonstration, you can see that I'm putting my non-dominant foot up to see the sway of my dominant foot, while also putting my hands on my hips and closing my eyes for 20 seconds. Points were taken off because I lost my balance, and usually that would mean I would need to increase my stability. For Captain Jello, you can see that he increases his sway to a point where he almost loses his balance. There would be points taken off, which tells me that he needs to also increase his stability by doing strength and mobility exercises. For the last part of this test, I'm demonstrating the tandem test, which is done by putting your dominant foot in front of your non-dominant foot, and putting your hands on your hips and closing your eyes for 20 seconds. If Captain Jello fails this test, it shows that he needs to work on his postural control, hip stabilization, and ankle stabilization, which involves muscles like the tibialis anterior, intrinsic foot muscles, and the gastrocnemius and soleus muscles. The demonstration that Captain Jello is showing is quite good. He is showing an increase in sway, but not to a point where he fails. This shows that he needs a little bit more strength in the muscles mentioned before. We're testing quadricep strength and endurance with the sitting leg raise. The patient sits with one foot flat, then extends the lower leg. We measure knee joint angle using a goniometer, placing the fulcrum at the lateral epicondyle and aligning the moving arm with the fibula, using the medial malleolus as the guide. This shows us their active range of motion. Based on these results, we'll decide if the focus should be on strength or flexibility exercises. This is a local muscular endurance test for the quadriceps called the wall sit test. The patient stands with their back against a wall, slides down to a 90-degree squat, and holds that position for as long as they can. The back stays flat against the wall the whole time. This helps assess the endurance and strength of the quadriceps and patellar region. If they can't hold the position long, it means they need more patellar strengthening exercises. Captain Jello demonstrates his wall sit with a perfect 90-degree angle. However, he can only last for 15 seconds, which would show that he needs to increase his strength in his quadriceps, gluteal muscles, and hamstrings. This is a cardiovascular and functional mobility test using step-ups. The patient steps onto a low box with one leg, pushing through the heel to straighten the leg, then brings the other foot up. This test assesses the knee mobility, and if they struggle with it, it suggests that they need to improve stability, flexibility, and strength, all key parts of overall mobility. The next assessment, we will conduct a flexibility test and will use the stand to reach method. Captain Jello will stand on the box with shoes off, legs straight and slightly apart. We'll reach forward as far as possible with no bouncing involved and hold the position for 2 seconds. A ruler is leaned against the box to measure the distance from the top of the box to the fingertips. We'll record the best of 2 trials. This test helps assess how tight the hamstrings and lower back are to make flexibility exercises. The first exercise that we will be prescribing is the seated knee extension. This isolates and strengthens the quadriceps without placing stress on the knee joint, ideal for improving function like standing and walking. The patient will do 3 sets of 12 to 15 repetitions to encourage slow, controlled movements, and the patient should fully extend without walking the knee. The second exercise will be the heel slides in supine position. The patient should be on their back. The slow impact movement increases knee flexion range, essential for walking and daily mobility. It's safe for sensitive knee joints. The patient will do 3 sets of 10 repetitions. Now the patient must move within their pain-free range without forcing it. If they feel any discomfort, they should stop. The third exercise will be the squat sets in isometric. This is great for rehab and it activates the quads without joint movement. Important when range of motion is limited. The patient will do 3 sets of 10 repetitions for holding for 5 seconds each. The third exercise will be the glute bridges. This targets the glutes and hamstrings, reduces low back tightness, and supports proper posture and lifting mechanics. The patient will do 3 sets of 10 to 12 repetitions. They will squeeze the glutes at the top and move slowly to improve control. The fifth exercise is called the bird dog. This can be modified by the elbows if needed. This enhances core stability, posture, and coordination. It's a go-to for low back protection during lifting tasks. The patient will do 3 sets of 8 repetitions per side. Emphasis on keeping the core tight and slow, steady movement. Modifications like the forearm support if wrist and knee pain occurs. The sixth exercise will be the wall slides. This strengthens the quadriceps and glutes without stressing the patellar tendon or meniscus. This will limit depth to reduce risk. The patient will do 3 sets of 8 to 10 repetitions. The seventh exercise is calf raises, chair assisted, which means that a chair is involved. This boosts ankle strength, balance, and circulation. This is important for walking and preventing falls. The patient will do 3 sets of 12 repetitions. To make sure that you're stabilized and balanced, be near a table, a chair, or a wall so that way you can keep balance. Keep movement slow and controlled, especially on the way down for eccentric control. The 8th exercise is called the seated hamstring stretch. This reduces tightness in the hamstrings and back, which is common in people with arthritis or prolonged sitting, like Captain Jello. The patient will hold for 20 seconds, repeat 3 times per leg. Keep the back tall and avoid bouncing. Aim for a light, comfortable stretch. The 9th exercise is called the child's pose. Cushion is needed, so a pad or carpet or maybe even the bed. This exercise is gentle and restorative. It improves hip and spine mobility while calming the nervous system. The patient should hold for 20 to 30 seconds and repeat 2 to 3 times. Use a pillow under the hips or chest for extra support or comfort. The final exercise is called step-ups. Low platform is needed. This exercise mimics real-life activities like stairs or lifting. This builds strength and balance in a functional way. The participant will do 2 sets of 8 repetitions per leg. Use a low platform or support like a wall or rail if needed to ensure control and knee alignment. Let's do an overview on Captain Jello's prescription. He is a 56-year-old male who is diabetic and came in with knee and back issues after he had an injury at work. He has arthritis, tightness in his back, reduced range of motion in the left knee, and he is mostly sedated, but recently has begun therapy. We're focusing on increasing his range of motion, strengthening his quadriceps and back, increasing overall mobility, and reducing pain and stiffness. These goals align with the daily functions, challenges at work, such as lifting and prolonged standing. For the pre-screening and assessments, he was cleared for light to moderate exercise based on the Part Q, with a BMI of 27.8 and slight elevation to his blood pressure. The tests that we have done were the BEST test, which helped test for balance and postural stability, the goniometer and wall sit test to measure his range of motion in the knee and the quadricep endurance. We also test for the step-ups, which was to assess mobility and cardiovascular function. We also assessed for flexibility, which was the sit and reach test to determine the hamstring and lower back tightness to help identify any limitations before prescribing exercise. For an overview of the exercise prescriptions, we did the seated knee extensions, which was to help with the quad strengthening without joint strain. We did the heel slides, which was a gentle knee flexion to help with mobility. We did the quad sets, which was isometric quad strengthening. We did the glute bridges to help with posterior chain and pelvic stability. We did the bird dog, which was core activation and lumbar stability. We also did wall sits, which was to help with controlling the glutes and the quadricep strength. We did the chair assisted calf raises, which was to help with balance and lower leg strength. We did the seated hamstring stretch to help with the postural flexibility. We did the seated hamstring stretch, was to help with posterior flexibility. We did the child's pose stretch to help with back tension, to help with relief and mobility. And then we did the step-ups, low platform, to help with functional mobility and strength.